I have practiced in St. Louis, Missouri for 16 years. And a couple years ago, I've moved to San Francisco Bay Area. And ever since I've moved to Bay Area, I've been participating in meditation classes, and not just Zumba, but also Bollywood dance. Um, the biggest difference that I saw as far as my patient population goes is that in St. Louis, I saw a lot of patients with wrist fractures. And I also saw, unfortunately, a lot of patients who had nerve injuries and tendon injuries from gunshot wounds. But in the past couple years in the Bay Area, I've mostly seen majority of my patient population has been computer professionals or other professionals who have to work with computers most of the day. Our topic today is about preventing pain during quarantine, and a lot of people are cooking more often and also baking more often than usual, and also spending time on laptops and computers. So what we end up doing is when we are cooking and chopping food and baking, we end up with this forward flex posture. So we'll talk a little bit about that, about what can be done. So there we go. Okay, so pain can have a purpose. And here's if you have, like Mr. Somnath mentioned, if you have any conditions, this is just supposed to be for general advice. This is the website for the American Society of Hand Therapists. It's www.asht.org. One of the most common conditions we see as hand therapists is wrist fractures and carpal tunnel syndrome. Especially here in the Bay Area, I see a lot of patients with carpal tunnel syndrome. So just so to keep things more fun and interesting, we are going to mix things up so you guys just don't have to listen to me talking all along. So let's watch this video. It's by the American Society of Hand Therapists. It's about carpal tunnel. So that's your carpal tunnel. It's a very narrow tunnel. That's the median nerve that can get compressed. We make braces for this. Yoga. Okay, so can you switch me back? Oh, yeah. Okay, so like the video showed, please do not self-diagnose. we make, as hand therapists, we make custom braces, or we recommend braces. If you buy braces off the shelves at a drugstore, those can keep the wrist pretty cocked up and actually put too much tension on that median nerve that we just saw. I want the screen.
You will see it. You will
Okay.
see it.
Okay. All right.
Have to go back. No. Okay, this is not going to let me go back.
Over there. That's the one.
But you can press it.
Okay, there. So now we'll talk about exercises as alternative medicine. So in our country, we have this huge opioid epidemic. Unfortunately, a lot of doctors, physicians prescribe medicines, but most often patients are not given a prescription for exercises. I'll be talking about exercises we can do during quarantine to counteract the forward flex postures. But overall endurance exercises also help with our perception of pain, and they help relieve pain by decreasing inflammation. So in 2008, physical activity guidelines were drawn in the United States, and it states that 150 minutes of moderate physical activity per week is recommended, or 75 minutes of vigorous exercise, in addition to twice a week strengthening exercises per week. And you can do your strengthening exercises using weights or bands, or you can go to a gym. Unfortunately, not at this time. Exercises also have psychosocial benefits. The psychosocial benefits especially help patients who have chronic pain. And there's a big difference between acute and chronic pain. Acute pain lasts only as long as the stimulus is applied, and it is protective in nature. So pain does have a purpose, but chronic pain is way complicated. And many times the injury, even after the injury has completely healed, the person continues to feel the pain. Chronic pain also has a huge neuropsychological process called central sensitization. And for chronic pain, especially, generalized relaxation techniques like meditation and things like that help. Here's a video. Actually, I'll just move on to the next slide and present the chronic pain video at the end.
Yeah, please continue with the slides to
Yeah.
maintain the flow. Yeah.
Right. So what can you expect when you see a physical therapist or an occupational therapist, or especially a hand therapist? Ideally, if you have any kind of hand condition, it is better to see the experts. You can visit the ASHT website. This one, to find a hand therapist near you. You can also talk to your doctor about referring you on. To find a good hand surgeon, you can go to the website of the American Society of Hand Surgery. And seeing a hand surgeon does not mean you have to go through surgery. It just means that you can get a better diagnosis. So what are some of the things we can do for pain? So some of the things we do as therapists is manual therapy and physical agent modalities. So manual therapy includes joint mobilizations, a very specialized technique called myofascial release, and also some soft tissue massage. Physical, if you are in pain, you can try using a heating pad or an ice pack. And you can also use a TENS unit at home. But please make sure you use the TENS unit based on your doctor's recommendation or your physical or occupational therapist's recommendation, because they have lots of contraindications. So here are the typical quarantine postures that I was talking about. People are cooking more often since they are home. So here we end up with a forward flexed neck and rounded shoulders. And here's a picture of a man using his laptop. Ideally, laptops are not good for ideally, please do not use laptops if there's an option. Please try to hook up your laptops to a docking station because unfortunately, if you place them on your neck or lower, then you end up flexing your neck too much or bending it too much. And if you place them way up high on the desk, then you end up shrugging your shoulders too much. So there are studies that show that the average screen time for people these days is about 7.5 hours. So what this leads to is forward flexed neck posture, which leads to weakness, it leads to tightness of the pectoral muscles and tightness of the upper trapezius muscles here and the levator scapulae back here. And it leads to weakness of the deep neck flexors. So what we need to do to counteract, let's do some exercises to reset our postures. So we can learn how to reset our postures during quarantine. So are you guys ready? Okay. So let's start with some shoulder shrug. Shrug your shoulders and relax. Okay. Okay, or else I'll just keep going. We can do the exercises at the end. The ergonomics of the desk is also very important. Please adjust the height because as I said, in the past couple of years, I've seen a lot of computer professionals and some of them even said to me that, oh, it's normal for software engineers to have pain. And I had to tell them, no, I'm sorry, but it is not normal for anybody to be in pain all the time. So here is the picture. Ideally, the top line of your monitor should be at eye level. And try to use an ergonomic keyboard, especially one that will keep your wrist in neutral to prevent carpal tunnel syndrome. Prolonged sitting is also bad for your back. And so what we recommend is high-low desk. We purchased one, it was just $400 on Amazon. And you can adjust the height to make the desk go up higher so you can do some of your work standing up. So it's ideally you should alternate between sitting and standing. Can you guys see me? Mr. Somnath, can you see me?
Yeah, very well, very well.
Okay, okay.
Yeah, I suggest you focus on the slides, you finish the slides and then we can do the exercise.
Okay, thank you so much. Okay. There were also some cool videos, but I'm not going to venture into playing those because, okay, joint protection techniques. So it's important to use your joints in an optimal position. Try not to use your thumbs to text. Try to hold your smartphones at eye level. Try not to flex your neck too much because some of the nerves that go into the hand can get pinched by the neck. We also recommend these what you call it, pop sockets. to hold the phone like so, so you don't have to grip. Because just as the video you guys watched about carpal tunnel showed, constant gripping is not good for the joints of the hand, or constant gripping increases the pressure inside the carpal tunnel to 10 times of what it is supposed to be. And as the video showed, it's a very narrow tunnel, and there are 10 structures that pass through the carpal tunnel. Especially during quarantine, if you're cooking a lot, make sure your knives have thicker ergonomic handles. Same for gardening. If you've started gardening, or if you're gardening more than usual, make sure you purchase really good ergonomic tools with built-up handles. Or the least expensive way is to wrap a wash rag or something around the handles of your tools so you can have a wider grip. The carpal tunnel video showed some of the splints that we recommend. Okay. And that's it. A generalized relaxation can help, especially chronic pain. So generalized relaxation techniques like meditation, deep breathing, mindfulness, yoga, and Tai Chi can help, because with chronic pain, it's more about retraining the brain and remapping the brain. So here we come to the end of our slides. So now I'm going to venture into playing the videos. Or would you rather have me do the exercises first?
I think you can go with the exercises first.
Okay. So to counteract the, and you can see me okay, right?
Yes.
Okay, so to counteract the forward flex postures that we are going to get with a lot of computer use, laptop use, smartphone use, and a lot more cooking and baking, what we are going to do is we are going to do exercises to stretch these tight pectorals. And also we are going to do some chin tucks. And like it was announced in the beginning of the webinar, these are not supposed to be individualized recommended exercises. If you have any medical condition, please contact your doctor or your physical therapist or a hand therapist to get customized exercises. Okay, so let's start with shoulder shrugs. Shrug your shoulders and relax. Do 10 of those for me, please. For the next one, what we are going to do is we are going to squeeze our shoulder blades together. So squeeze, make that proud chest. And do 10 repetitions. Sonia, come here, please. Take a seat, right? Just squat down right here. Squeeze right here. Okay. Squeeze like you are squeezing my hand. So that's your goal, to squeeze right here. Squeeze and hold. Okay. Excellent. Squeeze. Okay. Oh. Okay. So ideally, you do not want sustained joint positions for more than 20 to 30 minutes. So whether you're working on a computer or cooking, make sure you take breaks every 20 to 30 minutes. And it's okay to do only 3 repetitions of these exercises, kind of stretch your pectorals. The other thing we recommend is chicken wings. Mr. Somnath, can you guys see me?
Yeah, we can.
Okay. So stretch, bring your elbows back, and Excellent question. If it hurts, please don't do them. All these exercises have to be done very slowly, very gently, and do not do them past your point of pain. Uh, Start very slow. And that is why we are showing very easy exercises to counteract those tight pectorals and also to reset that posture. So the next exercise, the chicken wings can also be done. Again, do this only if you can do it very gently while doing thoracic spine stretches. So like so. Go ahead and do it with me if you can. And then roll your shoulders back. Another very important exercise to reset the posture for the forward neck thing we have going on with increased computer use is to just tuck your chin. And you're not just going to look down, you're going to pull your chin back. No. No, in fact, you don't want to do it this way. You want it to come back because you are doing it to counteract the forward flexed neck. So a lot of my patients who are computer professionals or even in other professions would tell me that even chefs would tell me that they do not have the time, but you owe it to yourselves. We are human beings. We are meant to move all the time, and we are not supposed to be working at a computer. So ideally, if not every hour, try to take a break at least every half hour to an hour and try to do only 3 repetitions. Even that can help. So 3 repetitions of all of these exercises will not take long. So what we are going to do is do 1, do the shoulder rolls, do 3, and then do the shoulder squeezes, shoulder blade squeezes, 2 and 3, and then your chicken wings, 1, 2, and 3, and then your chin tucks, 1, 2, 3. And especially for this one, the chin tuck, be very careful. Do it within pain-free range. If you experience any neck pain, contact your doctor. So if you think about it, this took me just 15 to 20 seconds, and you owe it to yourself for prevention, for preventing future injuries. Okay. We will be sending you the pictures of these exercises later. So here's the video. Here's the video for handheld devices. No, that's okay.
So I suggest that we might like to take some questions from the participants in the meantime.
Pardon me?
We might like to take some questions from the participants as well.
Oh, yeah. Okay. No, he's posting questions from the participants. Yes. Yes, go ahead with the questions, please.
Yeah, so one very fundamental question that comes up is exercise as a medicine, So you've been practicing for more than 20 years, and this is a favorite topic that you wanted to talk about. So how do you see exercise as a medicine? How should, very generically speaking, how should one approach to exercise as a medicine?
Okay, excellent question. Exercise as alternative medicine. Exercise has lots of benefits. It not only helps us stay limber and helps us keeps our muscles from getting tight. But exercise has lots of benefits. It reduces the risk of cancer, obesity, heart disease, and it is the only form of medicine that has been researched to maintain or even improve cognitive levels in Alzheimer's dementia and Parkinson's dementia. So overall, it has ton of benefits, and we just need to make time to exercise more often. So, like the studies have shown that the average screen time, besides work, of the average screen time for people is 7.5 hours these days. And this is based on studies. So why can't we take an hour out of those 7.5 hours? Or if your screen time is even 2 hours, if you take an hour off to exercise, it will help with, overall improving your cardiac capacity and the flexibility of your body. And it will keep your muscles from getting tight. And most importantly, it will help maintain cognition, especially for people who have dementia and things like that. And it actually helps prevent a lot of illnesses. And this is based on studies. It also helps prevent high lipid levels.
So you mentioned about, injuries, that are caused and, emergency care, and other kinds of accidents, So typically, what are some of the emergency response, techniques that people should learn, just to as a matter of care in those situations? You mentioned about that, but that's something that one would like to hear from you.
Are we talking about repetitive strain injuries? Okay, so for repetitive strain injuries like carpal tunnel and things like that, or even your tennis elbow, and it is better to contact your physician right away and seek care, because again, based on research, if you seek care for repetitive strain injuries like carpal tunnel, after 6 months, the prognosis is not that as good. For any other hand injury that occurs while cooking, like a tendon injury or a nerve laceration, it's better to go to the ER right away. Or fractures also.
So there's a couple of questions pouring in, which I just wanted to share with you. One is, how about exercise of ankle tendonitis? Ankle tendonitis.
Ankle tendonitis. Okay. So that is not my specialty. You can go to the APTA, the American Physical Therapy Association website. It's apta.org. And now, especially during quarantine, there are lots of physical therapists who are doing telehealth visits. So they can, because this is again a very individualized question, so they can contact a physical therapist who can guide them through the care with a very thorough assessment. Because when I see my patients, even I don't treat two carpal tunnel patients the same way. There's a lot of, I spend a good hour doing a very thorough assessment of what's going on. Sometimes, let's say, for example, for carpal tunnel, the patient can have numbness in the fingers, and it can be coming from the neck. And we do a bunch of tests to differentially diagnose. So I Ideally for the ankle tendonitis, please contact your doctor or your physical therapist. There are lots of professionals doing televisits, so which is very safe. You just have to, if you Google also, it's coming up which therapy clinics are doing televisits. I think Peak Physical Therapy is also is one of the clinics in the area doing.
Okay, so the next question is, what would you recommend one should do as everybody's sitting long hours at home, so it's not possible to avoid computer time. So what would be your recommendation to them?
Is this question from the United States?
It is, incidentally.
Oh, great. So I feel like here in the United States, we are lucky that at least we can step out of our homes and we don't have to be in a lockdown like people from countries like India. So I can share what we are doing. We wear our masks. We try to step out during times when there are not too many people around and go for a walk. If you want to make it interesting, change your route each time. Go for a walk, run, or even go cycling. But walking is very safe. You can do 20 minutes of walking start off at a very low intensity. And every 20 minutes, 20 to 30 minutes, try to do the exercises I showed you. If you have to use the computer, at least alternate between sitting and standing every half hour.
Okay, so the other question is, how much can massage help in reducing pain?
Excellent question. Massage can help a lot for acute pain, but some of the things I'm going to tell you are based on research. So based on research, massage and passive modalities that are used by therapists like the TENS unit or heat packs do not help as much. So one of the biggest benefit of massage would be the relaxation, and that may help you with the perception of pain. Also, touch signals. The most important thing to understand here is that finally it is our brain that interprets the pain, and touch signals travel to the brain faster compared to pain signals. So the touch signals can block the pain signals traveling to the brain and decrease your perception of the pain. And generalized relaxation helps chronic pain. So massage may help you indirectly. But what I would recommend is, especially if you've had chronic pain, which lasts longer after the injury, even after the stimulus has stopped or even after the body part has healed, you may experience pain. So for that, use all these passive modalities like massage or a heating pad or a TENS unit to for that to be your motivation to move the joint. So let's say if you have a stiff hand, after your massage, move it. Be gentle, start off gently, but motion is lotion. And the more you move it, for chronic pain, it helps with the mapping in the brain, and we can watch the video soon.
Okay, so this question is more for the teenagers. What exercise would you recommend for younger or teenagers, younger kids or teenagers, to prevent injuries related to overuse of computer, phone, etc., and what exercises they can do to improve posture?
Okay, so excellent question. So in general, for adults, the dosage for exercises is 150 minutes of moderate intensity exercises. For teenagers, it's twice as that. So it would be 130 minutes of exercises. And let's talk about intensity. So what do we mean by moderate intensity? So mild and the intensity of exercises can be classified as mild, moderate, and vigorous. Mild exercise is when you can sing and talk without difficulty. Moderate difficulty is when you can either sing or talk. And vigorous intensity is when you cannot do either. You cannot sing or talk. So if the teenagers are in the United States, they can go out for a jog or a run. My daughter goes for a jog and a run. She tries to go step out when it is not so busy. The streets are not as busy for safety during quarantine. My teenager has an input for this.
We can't hear her.
Every 15 minutes when you're using your phone or your laptop, you need to look up and stretch your neck, because if you're looking down or even if you're looking forward, it's still not good. You're straining your neck muscle. You need to look up, and the the nerves in your neck will lead down to your hand in the end. So there's that. Another thing is to not go on your phone for more than an hour. It's hard, but just set a timer on your phone or something. And then when that timer rings, you have to just end it.
There are also apps to limit phone usage. But for posture exercises, I showed those simple exercises, but the shoulder blade is like the foundation of the arm. So my daughter, I recommend shoulder blade strengthening exercises to my patients and my daughter. So she does those as well. Does that answer your questions? Or there are lots of things you can do.
So let's move to the next one. So I think
Sure.
That's pretty much what people are looking for.
Sums it up.
There's a question from, which is basically how many of us now use large screen iPhone, which is iPhone 10 and so on for many hours. What can we do for posture? Any equipment?
Yes. The bigger phones, when you hold them, like the American Society of Hand Therapists videos showed that the constant gripping is not good. When you're with bigger phones also, you're putting too much stretch on the median nerve that passes through the carpal tunnel. So these pop sockets help, because then you don't have to grip. You can just slide your fingers like so. There are also elastic bands that are called lazy hands, where you can grip the phones like that. There are stands for iPads and iPhones as well. But in my career in the past decade, since smartphones became popular, we are seeing a lot more injuries and problems, pain-related issues. We have there's something called as decurvain tenosynovitis, which is tendinitis of the tendons by the thumb. And in the past, it used to be called mommy thumb, because even I got it as a new mom from picking up my baby. But now it's called the BlackBerry thumb, because people get it from texting. Ideally, no matter what iPhone you have, try not to use your thumbs to text, because our thumbs are meant for strength-related activities like gripping and squeezing. They are not designed for dexterity. Oh, good job, Mr. Somnath. You're using your fingers.
Okay, so one more question here. When you're in pain, till you get the needed help, how to decide the body part to move or not? And what are some of the generic guidelines you can share?
Okay, and which body part are they talking about?
Yeah, that's something, yeah, it's not mentioned here.
Okay,
We
okay,
can probably focus on the
on the
upper, yeah,
question.
yeah.
Okay, so if your pain is severe, it could be anything. It could be a fracture, it could be something more severe. So ideally seek medical help and try not to self-diagnose. And there are a lot of physicians doing telehealth visits as well. So I would seek medical advice.
Okay, okay. So the
I know
next
it's,
question,
unless you're very sure it's just stiffness from too much screen time, then you can try to, or static postures, then you can try to move it gently if it is
right,
mild pain.
right, right. So what are the benefits of hot versus cold compress?
Okay, so there are different stages of healing actually. So there's an acute phase, then which lasts for about a week, and then there's an inflammatory stage. So I've heard a lot of therapists suggest that use what helps you with pain, but for acute pain, what we recommend is in the acute stage of healing, which is the first few days, use a cold pack to prevent the swelling from getting worse. And after that, when the healing goes into an inflammatory stage, which is after the first 5 days, after the first few days, try to use a heating pad to help with increased blood circulation and things like that.
So there's another smartphone question, which says, are you aware of, or can you recommend any kind of smartphone stand so that we could use it standing?
Yes, my my nephew has a stand like that he can use it standing up.
Okay, so I think we are
So
doing very well in terms of the time. We have about 4 minutes. So any final message that you want to convey to the participants? We have some announcements. Dr. Sachin Deshmukh, we would request to put some of the links. So we have two interesting programs. One on Sunday, which is very focusing again on lifestyle and diet. And we have Dr. Alan Goldhammer and Dr. Naresh Bhatt. So they'll focus on, SOS diet as well as intermittent fasting, and they have more than 20 years of research results that they're going to publish there. And then we have another one on the 25th of July. So this Sunday, 19th July and 25th of July, please block your calendar for that. And we'll be putting the link here in the window for you to register if you haven't done so far. So having said that, over to you, Trisha. Wonderful session, a lot of tips, and I'm sure we'll have more of you when we can actually get a deeper insight through the video and a little more exercises. Okay, we can structure the program like that. But any final message from you as to what are some of the things that in these quarantine days they should be you can our participants can actually learn from you and actually adopt at home.
okay, so I know this is very difficult to do, but the key is to limit our electronic use, cell phone use and computer usage, and also avoid static postures for more than 20 minutes. So whether you're cooking or baking or using your laptop or computer, take a break every 20 minutes, do the three or four simple exercises that I showed you. It's very easy. Roll your shoulders back, do your chicken wings and shoulder squeezes and the chin tucks. That's it. It should take you only about 20 seconds, 20 to 30 seconds to do these exercises, but alternating the static postures. And to me, it's really worth investing in ergonomic devices and stand-up desks and built up handles for your knives and your gardening utensils and things like that.
No, that's very useful. So I'm sure, we'll take home some of these points, and of course, we'll be more mindful using the electronics that we tend to get addicted to, and sometimes for all the right reasons, because it's become a companion for doing a lot of our work and a lot of our errands to be performed through these devices. Once again, wonderful having you. And I just wanted to again alert, the links are there in the chat box. You can see. Thank you, Sachin, for putting them together. And thanks, Sachin, for all the support for this program. It's always wonderful to have you with us. So please use these links for two very, I would say, high impact events. That's going to be our 51st event, which is on Sunday, 19th, and then the 54th event on the next Saturday, both on mind, body, wellness, and holistic health. So look forward to seeing you then, and be engaged, and of course, be mindful of some of the tips that Trisha has shared with us. Thank you, Trisha, and thank you,
my
everybody.
pleasure.
Yeah.